Juvenile myoclonic epilepsy is a common genetic generalized epilepsy syndrome, typically presenting around the adolescent period with with a triad or three types of common clinical manifestations. These jerks are the sort where there's an axial sort of brief, sudden jerk of the shoulders, the trunk, the limbs, the lower extremities, and so forth. It's just kind of a jerk that is sudden, irregular. It can be irregular or a little regular, and happens at certain periods of time, which I'll discuss. So, juvenile myoclonic epilepsy will often have the myoclonic jerks. It can also manifest with generalized tonic-clonic seizures, what we classically called grand mal seizures in the past, and sometimes absence seizures, seizures where you stare off. The onset of juvenile myoclonic epilepsy is usually around the ages of 10 to 25 years of age, with a peak in the mid-teens. And like I mentioned, the clinical manifestation is commonly the bilateral myoclonic jerks. Both sides, most often involving the arms, most occurring shortly after awakening, and often is precipitated by sleep deprivation, stress, or alcohol. A common manifestation that I'll hear from families is or patients is that they just feel a brief jerk of their extremities. It kind of gets worse in the morning. If they are have a cup of coffee or some sort of they may drop that cup of coffee just because it's of such an involuntary jerk. And I mentioned it can be precipitated by sleep deprivation, stress, or alcohol. So we commonly counsel patients to find ways of getting enough sleep, lowering their stress level, and trying to reduce the amount of alcohol that they consume because this can make those jerks worse. It's generally not considered a severe epilepsy in terms of neurologic decline, but it is often a lifelong disorder for most patients with a tendency to relapse if seizure medications are discontinued. There are a lot of high functioning individuals in society and the community that have juvenile myoclonic epilepsy, including doctors, politicians, and people with with a high degree of education and that do highly competent work. So if you end up with a diagnosis of juvenile myoclonic epilepsy, or one of your family members do, it doesn't mean that you can't have a great quality of life and can't achieve great potential. So it's not something to find yourself necessarily limited in your achievement, but it's something you have to know about, and something, and you have to find a way of balancing the use of medication and your seizure control, and just to live the best life you can.